Hi there. We're going to talk through the 5 basic principles of skin and wound care. To be clear, wound care is a huge topic. You could review entire textbooks, you could take lengthy courses on the topic. There's a lot to learn. At the end of the day, though, I think these 5 basic concepts can help you approach most wounds in an organized fashion. So, the first thing I'll do is talk through all 5 concepts, and then we'll dig into each one in a little bit more depth. So, the 5 concepts are number one, clean it. Number two, if it's open, cover it. Number three, if it's deep, pack it. Number four, if it's wet, dry it. And number five, if it's dry, wet it. So let's talk through each of those in a little bit more depth. Number one, clean it. This can be something as basic as, for instance, if you have a scrape on your knee, you're just going to clean it in the shower with soap and water. However, when you have larger, more complex wounds, you might need a more in depth cleansing regimen. That could include something like normal saline, it can include irrigation, it could include a no rinse dermal wound cleanser, it could include an antimicrobial rinse. Still, at the end of the day, cleaning a wound is an important part of wound care. Number two, if it's open, cover it. You see this in your home life when you get a scrape on your knee, you cover it with a band aid. We know that covering a wound is going to speed healing because it's going to minimize your risk of infection in that open skin. And it's also going to help that wound bed stay protected and warm and expedite healing. Number three, if it's deep, pack it. So we're thinking about wounds that have some depth to it, some type of cavity there or tunnels. If there's depth to that wound, we want to make sure we're packing that space loosely with some kind of absorbent dressing to keep mobilizing fluid and help pull out any fluid that, if it pools there, will put that wound at risk for infection. The last 2 concepts, if it's wet, dry it, and if it's dry, wet it, have to do with achieving a moist wound bed. And we know that a moist wound bed has the best chance of healing. So we're really looking for that Goldilocks level where it's not too wet and it's not too dry. If it's wet and we need to dry it, there's a lot of different absorbent dressings we can use to sort of sop up that extra moisture. And we think about what happens when a wound bed is too moist, when there's too much drainage there. It sort of overflows onto the peri-wound tissue. That skin gets that sort of waterlogged, fragile appearance that puts the peri-wound skin at risk for breakdown. Um, and we really need to sop up that extra moisture. Then the last step is, if it's dry, wet it. So we think about wounds that are just dry as a bone. Those ones are going to take longer to heal. So generally speaking, we want to use some kind of a moisture donating dressing. Could be an ointment, could be a topical bandage, could be those 2 things together. But thinking about ways to donate moisture to the wound bed so that it will have a chance to heal faster. There is one important caveat for that last comment, that last concept of, if it's dry, wet it. There is an exception to that rule, and that exception is if there is dry eschar, so black, dry, devitalized tissue on the heels. We do want to leave that. We don't actually want to donate moisture to those wounds in that location. However, generally speaking, for the vast majority of wound care situations, if you think about these 5 concepts of clean it, cover it, pack it, and then consider if you need to dry it or wet it, that's going to put your wound on the path to healing. Thanks for watching.